You're sitting in your doctor's office. You've written down all your symptoms, the exhaustion that won't go away, the weight you can't lose, the brain fog, the mood swings, the fact that you don't recognize yourself anymore. Your practitioner runs some tests. You wait anxiously for the results, and then you hear those 3 crushing words. Everything is normal, but you know it's not normal. You feel it. Something is wrong, and yet the tests say you're fine. The labs say you're fine. So you walk out of that office feeling gaslit by your own body, wondering if maybe it's all in your head. Maybe you're just tired. Maybe you need to try harder. What if I told you that normal labs and optimal health are 2 completely different things? And what if I told you there's an endocrinologist out there who actually gets it? Welcome back to the Dr. Terri Show. I'm Dr. Terri Denai, and we're continuing our year-end replay series with the conversations that changed how you think about health. The interviews that made you feel seen, the episodes that gave you permission to trust yourself. And with Christmas just 2 days away, in the middle of all the chaos and cookie exchanges and family stress and staying up late wrapping presents, this is the episode you need to hear. Because it's about listening to your gut, literally. About giving yourself permission to rest. About loving yourself the way you love everyone else. And honestly, that might be the best gift you could give yourself this season. Today's guest is someone I call a unicorn. Dr. Cassie Smith is a board-certified endocrinologist who does something almost no endocrinologists do. She practices a functional, integrated approach to medicine. When I teach hormone optimization courses around the country, I always ask, do we have any endocrinologists in the house? The answer is almost always no. Because what we teach, root cause medicine, hormone optimization, treating the whole person, it goes against everything traditional endocrinology has been taught. But Dr. Cassie, she walked away from all that. She left the prestigious research centers. She left the big hospital systems. She walked away from insurance-based medicine because she realized something that most doctors know, but few will admit. Prescribing more and more medications doesn't make people well. It just manages symptoms. And here's what makes her story even more powerful. She didn't just figure this out intellectually, she lived it. In medical school, Dr. Cassie developed Graves' disease, an overactive thyroid condition. And you know what the standard treatment was in 2008? Radioactive iodine. Basically, destroy your thyroid. She asked her endocrinologist a simple question: what can I do besides destroying my thyroid? The answer she got? Nothing. And she thought, that seems odd. God gave me a thyroid. I probably need it. So she started asking why. The same question she's been asking since she was a little girl, annoying her dad. Why do people get sick? Why don't they get better? Why does the body do what it does? And those questions led her down a path that changed everything. Dr. Cassie started seeing patterns in her residency. Everyone coming in had the same cluster of issues: diabetes, high blood pressure, high cholesterol, overweight, obese, the same medications prescribed over and over and over, and nobody was getting better, just managed. She watched patients get sicker and watched herself get sicker. And then she realized the system was broken. So she did what few doctors have the courage to do. She left. She built her own practice centered on functional endocrinology, looking at how all your systems work together, not just treating one isolated problem. In this conversation, Dr. Cassie breaks down the connections most doctors never talk about. The gut hormone connection, why your thyroid might not actually be the problem, even though everyone keeps testing it. How insulin resistance and inflammation are quietly destroying your health. She explains why your mitochondria, the powerhouse of your cells, are the key to everything. Why most people's weight gain isn't about calories. How she uses microdoses of GLP medications in ways that reverse inflammation, not just suppress appetite. And she shares something I think is revolutionary, her check-in with Cassie practice. Every single day she asks herself, how am I really feeling? Am I well fed? Am I rested? Does anything hurt? Emotionally, how am I doing? This episode was a powerful one this year, but I have to tell you, 2 days before Christmas, this message hits different. In the middle of all the chaos, take an hour, sit down with this conversation. Let Dr. Cassie's story remind you that you're not crazy, you're not dramatic, and you deserve to feel well. Here's my conversation with Dr. Cassie Smith on listening to your gut and taking back your health. Everybody, welcome back to the Dr. Terri Show. I have Dr. Cassie Smith on with me, and you can, obviously we have all of her information in the show description, but I'm so excited to have Dr. Cassie on the show, primarily because she's an endocrinologist. She really is kind of a unicorn in her field. And I'm so wanting to know how you got into this space, Cassie, of functional endocrinology. That's my burning question because, as you know, and a lot of our listeners know, we train clinicians all over the country in hormone optimization, and every single training, either Dr. Johnny P or I will say, do we have any endocrinologists in the house? And, it's never, no is the answer. Never. And so it seems like a lot of what we teach is very, against the religion of, endocrinology, you know. So I just would love to hear your story and, where you came from, what got you into endocrinology in the first place, and then how you got into functional endocrinology and your practices in Oklahoma City, I believe, right?
Yep. Yeah. So thanks for having me. So I think I got here how a lot of people got here, through like my own personal journey, health journey, but then also just my desire to take better care of patients. So I grew up in a small town in Missouri. Nobody in my family went to college. When I was really young, my dad said I annoyed him because I always wanted to know why. So since I can always remember everything, but I didn't understand why, it just bothered me. And so I knew whenever I was younger, I had a lot of questions like, why do people get sick? Well, why don't they get better? Whenever I would get sick, why does my stomach hurt? I don't know. So just ever since I can remember being little, I wanted to know why the human body did what it did. So I think that's where like medicine, obviously, I was very interested in medicine. And so when I went into medicine and I went to medical school, even whenever I was in school, I still had this burning desire of like, okay, they teach you in medical school all the basic things, how your body works, chemistry, biochemistry, anatomy. But my question was like, okay, well, how does it all work together and why does it work like that? And they sort of teach you that, but not really. And so when I got done with medical school and I did residency in internal medicine, I got to see all these chronic disease processes, in a regular medicine clinic. Everyone had, diabetes, hypertension, hyperlipidemia, and obesity. And my question was like, why do so many people have this? And why do you have some people that have this and some people who don't? And what I quickly realized is a lot of it is lifestyle. Some of it is genetic. And so my burning question was in residency, well, why aren't we educating people about this better? And then when I was in medical school and residency, I actually developed a thyroid issue. So I got Graves' disease, which is overactive thyroid. And when what they told you in 2008, 9, and 10 was, would you do radioactive iodine, which is where they ablate your thyroid? And I thought, well, God gave me a thyroid. I probably need it. So why would we just ablate it? So my question to my endocrinologist was, well, what can I do besides just ablating it? And the answer was nothing. And I was like, well, that seems kind of odd. And so I Google it, and there are other things you can do, even in 2008, 9, and 10. And so it really got me in this mindset of like, why do we just like shove medicine at people? Why don't we actually try to figure out what's causing it? So that's what kind of drove me to endocrinology, was I wanted to learn more about my own thyroid issue. while I was in residency, my Graves' disease thankfully burnt out. I did methimazole instead of radioactive iodine. I did some lifestyle changes. I learned in 2011 that you shouldn't eat gluten. So I haven't been eating gluten for 14 years, and I stopped dairy and all these things. And then I developed Hashimoto's, unfortunately. So then I was really passionate about, well, why do I have Hashimoto's? So that's kind of what drove me into endocrinology, was just I wanted to learn more about the thyroid. And then when I was in endocrinology, I learned a ton about thyroid. I learned a lot about diabetes. I've always had this desire of like, why do people gain weight? Why is it so difficult to lose weight? So that's kind of how I ended up there. The sad part is that I did all this training and I did fellowship at the Harold Hamm Diabetes Center in Oklahoma City. I did a ton of diabetes research. I did research on Ozempic, on Jardiance, like a lot of the cutting edge medication. And when I got out of fellowship, I was like, okay, great. I have all this, knowledge and all this expertise. I'm going to go start working and I'm going to make people better. That was like my whole goal, right? So for 2.5 years, I worked for a big hospital system. And every time people came in, they were sick. And I gave them a prescription because that's what I was taught to do. And when they came back, they were sicker. And I gave them another prescription. And when I turned around 2 years later, I was like, all these people that I'm taking care of are on 8 medicines now instead of 2. They're really not any better. They're getting fatter. I'm not really happy. Like, what is going on? And so I had this like come to Jesus moment in February of 2020, right before COVID, where I went home and I told my husband, I said, I'm going to quit medicine. And he was like, what? Well, you owe $500,000 in student loans. You're not quitting medicine. And I was like, well, I'm just really not happy. Like, I thought I was going to have this job where everyone got better and I'm so unfulfilled. And he was like, well, you're going to have to figure something else out, sister. And so I just started like researching online, right? This was 2020. Like, there's got to be something better. And I found bioidentical hormone replacement. Like, people were talking about it in 2020. And so I went to some training and it like blew my mind. I was like, I didn't learn any of this in residency or in medical school or in fellowship. Like, nobody taught me anything about T3 and nobody taught me anything about the thyroid. And sure, like, nobody told me anything about nutrition or your gut, which is insane. Like, I think I had a 30-minute lecture in med school about nutrition. And so I really like got into this path, not only for my patients, but myself in 2020. And I just started teaching myself all these things about functional medicine and about hormones. That's when I brought hormones into my practice, bioidentical hormones. And the last 5 years of my life have been so rewarding and so different, not only for myself, but for my patients, And so it's just inspiring when you see people get better, you want to keep learning. And so over the last couple of years, I've really looked at the gut. And then I'm happy to say that in December of 24, I was the endocrinologist in your training. So at least you've had one in, right? I came to your training, Dr. Pete and you taught me some more things, which was amazing. And so that's kind of how I have just, I really, myself included, but I really, really have this like desire to make my patients better. So like when I can't give my patient an answer or I feel like I failed them, I lose sleep over it. Like, it bothers me. And so I just really want people to feel well because, my thought is like, my job, my purpose on this earth is to help people understand how to feel better so that they can go fulfill their purpose. And, if everyone on this earth felt 10% better, just imagine how cool the world would be. And so that's like my why every day is just like, how can I help you feel better? And in order to do that, this medicine is very complex and you have to be able to think outside the box. You have to understand things. And I tell people, God had this very great divine timing for me because I didn't know it. I thought I went into endocrinology because I had a thyroid issue, but I think I went because I was supposed to learn all these things and how the body actually works together. I have a really good grip on that, like your pituitary, your pancreas, your thyroid. And so it's just helped me be able to take care of patients so well from like a hormone perspective.
Narcissistically, I love you so much because we think exactly like I knew it's like we're in the same tribe. But man, what do you think? Why do you think it's so hard for the average endocrinologist to grasp some of these things? Not from a judgment space. I'm really curious when you've got data from your own literature that's staring you in the face, telling you that the things that you're doing are probably not going the right way. Like, where's the gap there, do you think?
I think there's a couple, Dr. Terry. I think one is like, we aren't taught that, right? So it's very like outside the norm. And most physicians are, those like type A, want to put everything in a box. That's what makes them a good physician in general, right? Like when you're dealing with somebody's life, you want to make sure you're detail oriented and you're following the rules. But the problem is that the rules we have to follow right now really suck.
Yeah.
So like they're not good rules. And so I think there's a lack of education, big time. There is a lack of just the fear, I guess, of stepping outside. Because I remember when I started doing this as an endocrinologist, there were people that like attacked me, and there were endocrinologists.
Oh, I'm sure.
I worked with 5 of them in Oklahoma City who told patients I was crazy, lost my mind, and I'm like, okay. Because I think that there's that fear, but thankfully I don't give a shit what people think.
Yeah.
I have way more problems than that. So I think it's the fear of like being hated or just like the fear of what are people going to think. I think it's the lack of education. And then unfortunately, I truly think that doctors do what they feel is best or what they want to feel is best. But I think the problem in our current medical society is the time, the lack of depth, right? So care is so disorganized. It is so poor. And when you work, because I did it, I worked for a hospital system. You have 10 minutes to see someone and address the 5 chronic medical issues they have. And and it's just, I think that people just get on this hamster wheel and they never get off. And I will say that I think a lot of people are unfortunately not happy as physicians. It's like if you look at physician burnout, it is so high. And it's high because they're scared to follow their heart. Like they forgot why they became a physician, right? Right. They never forgot. Like I always knew. And that's where I was so depressed in 2020 because my heart wasn't aligned with what I was actually doing. Right. I was just like, okay, well, I have to figure this out. And so I think it's a combination of, unfortunately, all of those things. And so what you do is so valuable, and training all these providers and doing a really good job of doing it, because I've been there. It's so valuable because we have to do this so that people, when you train somebody and they have their hearts right, like I would say that most people who come to your training, almost 99% of them are going to leave and they're going to take what you taught them, and it's going to change their life, their practice, and their patient's life. And that is
they'll do it. Absolutely. And I think it's like you said, there's a lot of confirmation bias with the way we learn things. So I think you said a lot of great stuff. But kind of confirmation bias is how you learn it the first way is kind of what sticks in your brain, and it's so hard to veer from that. So the first thing you have to do is you have to be humble enough to go, you know what? I don't know everything. Maybe there's a better way. Clearly you said that, you were looking at your patients. You're like, I'm not making them better. I'm making them worse. So something's not right with the way the system is and what we're taught to do. And so you have to be humble enough to admit that and be open to something, and then take the next step and seek out the education that can really help you and follow your gut. You said another really important thing that a lot of clinicians, and we hear this all the time from doctors and practitioners that come to our training, is they've known in their gut that what they were doing wasn't right, but they just didn't take that step forward, that leap of faith. It's what they know. People get comfortable in what they know. And the other thing that you said too, that's just highly, is the time. I mean, the time, there is absolutely no way in 10 to 15 minutes you can really address and turn around and change the trajectory of someone's health, which has a ripple effect generationally. Especially now we're seeing, all this epigenetic data that's saying, the health of the mom directly correlates to what that baby and that kid is going to deal with all through their life. It's super, super fascinating. So, I'm blown away at the fact that you're a functional endocrinologist. So just for our listeners, explain what that means. Like, what did you bring into your knowledge base and your toolbox that made you a functional endocrinologist? What does that even mean?
Yeah. So what that means is so I don't take insurance. I got out of that model because you can't help somebody in that model. So what that means is if you come to me, I want to fix you, all of you. And so what I do is, first of all, I listen to you and I validate you. But then I look at everything as a whole. So I have a really good, grasp and understanding of not only hormones, but thyroid, insulin. Insulin, I think, is the number one reason most people in this world are sick. have disease processes and die. It's the most inflammatory molecule in your body. And so what it means is like, I listen to you. I take everything that you're saying into consideration. I do a very thorough lab workup, and then we talk at a cellular level. Like that's where we start. Like we start with your mitochondria. Are they working? Are your mitochondria, which is the powerhouse of your cells, are they even able to accept the hormones I'm going to give you? Because I can dump a truck full of thyroid hormone and estrogen and progesterone, whatever in you. But if your body can't take it and utilize it, it doesn't matter. So we really focus on like at a cellular level, how healthy are you? Can your cells even accept what I'm going to give you? Then we look at your gut and we talk about, how is your gut functioning? What are you eating? Is your gut helping your hormones or not? We look at your thyroid, we look at your hormones, we look at your nutrition. I have a nutritionist who is phenomenal. She's one of the best in the country, in my opinion. And I have patients see her so we can just see in general, like, are you getting the nutrients you need? Are you getting the electrolytes that you need? Are you getting the protein that you need? We talk about sleep. We talk about movement. We talk about relationships. We talk about how we treat yourself as far as like stress. So we do all of that because I told people I can't make you healthy unless all of those, like we're working on all of those things. Because you can look great on paper. You can look like you're an A+ on paper. But if you're telling me you don't feel well, and that's what happens to a lot of people, then we've got a disconnect. Either those hormones aren't getting into the cell, or something's wrong with your gut, or your stress is high, you're not sleeping, you've got some trauma you've blocked off, something. And so when I say functional, that's what I mean is like, I really want to get to the root of what's causing your issue, no matter what it is. And we also don't I will use a prescription drug if I need to, but that's not my jam. So I tell people, if you want to come to me and you want me to write you 4 drugs and you want to walk out of my office and do nothing until you come back, I'm not your person. You're going to leave with homework. You're going to leave with something to do. You're going to, and so that's where we say functional. We're just very holistic based and trying to make you feel better, because my goal for you as my patient is for you to know how to take care of yourself, to be healthy, and to come see me every 6 months or once a year. I'll show you your lab work. You tell me how you feel. We'll validate that you're healthy, and you go do the amazing things that you were put on this earth to do. So that's what I consider functional. And I think outside the box, I use all the things you do, all the peptides, all the supplements, all the the cutting edge stuff.
Yeah. Well, that makes sense, because in what you just described really is this recognition and this awareness that the body is a system of systems. That's Dr. Laval's statement, and I love it because it's just so accurate. You can't, and I talk about this a little bit in the beginning of my book, like so many specialties, and you're a specialty practice, but they get tunnel vision and they don't realize that this system affects this system, affects this system, affects this system. And the endocrine system affects all of them, every system, head to toe, and really grasping the fact. And I even see this, cardiologists should be looking at the gut. Endocrinologists look at the gut. Pulmonologists, it all works together. And so the fact that you have that basic understanding just sets you leagues apart from other clinicians, especially endocrinologists in your space. And it's so exciting and hopeful to me. You really need to be teaching at the university level, really. But, I don't know if they would grasp on to what you're throwing down.
I'm thinking about it, but but to your point, it's so simple. And that's the hard thing is I feel like we make everything just too complicated today, right? Because of social media, because it's people come to me and they're like, well, this person said to eat keto and this person,
I know.
We get everything so hard. And it's what
hard
things basic, right?
I'm gonna throw my, it's not that complicated. And you just said something funny, because I was teasing my staff. For some reason, my staff is on this parasite cleanse thing because somebody saw it on Instagram, and I guess it's trending. And half of them are sick as dogs right now because they're doing because I'm like, leave your body alone and don't get your medical advice from Instagram, please, unless it's Dr. Cassie.
Or doing a GI map. And if you truly have a parasite, give you a few, we can give you a few supplements to take care of it. But I agree. It's just there's so many things. And I think we just, unfortunately, in medicine's the same way. Like you said, we see the forest, we miss the tree. As a GI doctor, my favorite is dermatologists. God love them. 95% of what they see could be fixed by fixing someone's gut and or stress and or cortisol. And they give them Accutane and steroid creams, but the same thing, pulmonologists, like if you're having issues with breathing or things like that, like why don't we talk about, dairy causes a lot of issues with upper respiratory and wheezing. And so it's just, I feel like medicine, and again, it goes back to they're trying to see 30 people a day. And so the quickest thing they know to do is write a prescription. And some people want that, but it kills me because it's so awesome. Like I tell my husband, I actually have the coolest job in the world, although it can be stressful. Like every day I get hugs, I get thank you, I feel better, I can function better. My favorite is the moms who are like, oh my God, I can take care of my kids. They don't annoy me anymore. And because they're doing the hardest work in the world. Moms and teachers, like you are making our future. And so you can't do that if you don't feel well, you can't do it well. And so it's.
Well, I want to talk about hormones because that's what you're passionate about. And I love hearing, an endocrinologist's take on bioidentical hormones because that's against your religion that you were taught in school. But, because it's such a hot topic right now, before we get into the hormones, I really want to know your opinion on the GLP-1s. We talk about them. I've interviewed Dr. Laval and I have talked about it. You studied Ozempic in some of your advanced training. I'm curious about your take on it. And what do you see? What is your opinion on them? And what do you see that we could do better with regards to using them?
Yeah. So I think that the GLP-1s are one of the most fascinating drugs that have ever been created. I think that there is so much misconception about them because people don't understand them or understand how to use them correctly, almost like bioidentical hormones, right? I have so many patients on GLP-1s. I think that the doses that you can get from a, pharmacological or like what you get from the pharmacy. So the doses that we have made for diabetes are super therapeutic. I know they are. So the thing we have to remember is GLP-1 is natural. Like we have GLP-1 in our body. We lose it as we get older, as we make poor lifestyle choices, just like we lose estrogen and testosterone. When we give it back to someone, if you give it back to them in physiologic doses, meaning what their body made, magical things happen. When you give it to people in supra therapeutic doses, very high doses, then you get a lot of bad side effects. So what I studied in fellowship was giving it to people who had diabetes. Those are super therapeutic doses because they needed that to treat a disease process. They work on diabetic patients. But when you give those big doses to people who are not diabetic, it makes them sick and they have side effects. I have hundreds of people who take microdosed GLP-1s, how I see and we see fit, maybe not the same time schedule, definitely not the same doses, but they do it for inflammation. And it is the only drug, Dr. Terri, that I have ever given anyone, because I'm a huge lab junkie, I can give someone one dose of a microdose of semaglutide or tirzepatide. It will bring their CRP levels down 3 or 4 points in 1 week. It is the wildest thing. Like inflammation comes down, insulin comes down, they feel better. And so I am a huge fan of GLP-1s. I do understand that they could have side effects, and they do have side effects when used inappropriately, but I write a lot of them. I don't have patients that have symptoms because we do them correctly, right? We dose them correctly. So I find, they lower insulin. We have receptors on your heart. So I actually had a patient recently who had severe heart failure. He had an EF of 10%. He's in his 40s. They couldn't tell him why. No one could tell him why. All of a sudden, this bodybuilder firefighter has an EF of 10%. He goes to the best heart hospital in Oklahoma City. They put a life vest on him, say you probably need a heart transplant, put him on a beta blocker where he can't even stand up. He's on digoxin. He's on blood thinners. He feels like complete shit.
Allopathic medicine at its finest.
What? He said, I would rather die. And nobody could tell him why. I still don't know what happened. I think he had something viral. But what we did was we fixed his cell membranes. We fixed his gut. I gave him a tiny bit of GLP-1 because we have GLP-1 receptors in his heart. I gave him a lot of other peptides. We did this whole protocol. We did ozone. It took about 5 months. Last week, I saw him and his EF is 60%. He never took the beta blocker, never took the digoxin, he never took anything. And his cardiologist said, and he told his cardiologist, I didn't take any of that. I went and saw Cassie, and his cardiologist called me and they were like, I don't know what you did to him. I'm not sure what sort of voodoo medicine you did, but it's fine. He's
what sort of voodoo medicine? You did logical medicine is what you did.
Yeah. So, I mean, my point is, like, I have seen so many amazing things with the GLP-1s. Again, to your point, though, they have to be used correct. And I understand the physiology of them. I understand where the receptors are. I understand how they work. And I am so comfortable with them in the right dose. And I have seen them change lives. So I love them, and I hate that they're villainized.
Yeah.
They're not available to everyone in the doses that are needed, because a lot of times the doses that the pharmacy has, we don't need those big doses.
Yeah. Yeah. You said so much that's so cool there. And then one of the things that to hone in on the microdosing, and you can only get that through a compounded GLP-1, obviously, because when it's compounded, you can draw up the dose that is right for you. And the other thing that I believe, because we use a lot of GLP-1s in our practice too, and just see amazing results. And one of the things that we don't see that many of primary clinicians that are prescribing the brand see is we don't see the muscle wasting. Why? Because we have all of our patients on testosterone, right? So we're addressing that aspect of it. And because of the microdosing, to your point, you can mitigate all those side effects, because if they have a side effect at this dose, well, you can just back them down, as eventually those receptors in the gut get a little desensitized. But I'm a why person too. When, you said that on a previous interview, and I always ask why, which is why I went from nursing into, I really wanted to go to medical school, but the track was too long and I had 3 kids and it wasn't, so I went to nurse practitioner school because I just wasn't comfortable with a doctor giving me an order at a hospital and I'm not understanding what I was doing to the patient. I was just following an order. So I would always ask why. And thankfully I worked in a teaching hospital where there were just some great teachers that answered my why questions. But why do you think that what do you think is happening physiologically that it's impacting inflammation so much? I mean, I think I know the answer, but I want to hear it.
Well, I think, so one of the things GLP-1s do, they have receptors in your pancreas and your heart. One of the things that I think, that I know happens with GLP-1 is it lowers insulin levels, right? So that's what it's meant to do. It lowers insulin levels in lots of different ways by actually increasing your satiety when you eat, by helping your pancreas make insulin, but make it more efficiently so that it actually works. And so that your blood sugars aren't going up as much. So the problem with insulin resistance is people are making insulin, they're making a ton of insulin, they're making ineffective insulin, and their blood sugar is really high. And then when all this insulin is splitting around, they're not taking this insulin in. So they're like resistant to this insulin because they're like, this has been around too much. So the GLP-1 is helping these cells actually become more able to take in the glucose. So they're kind of helping with this insulin resistance. And then they're helping the insulin that's being made be more efficient. And so I think that the reason you see the lowering of the inflammation is because we're getting rid of a lot of this insulin. We're getting rid of a lot of this glucose. And insulin is so inflammatory. And so, I follow these numbers. If you look at blood work, when insulin goes down, then guess what? CRP goes down. Cortisol goes down. I mean, and so that's why I think now there are other things happening in the heart. I think there's some vasodilation that happens with the GLP-1. There are things that happen in the kidney, definitely increases blood.
And the gut.
And same thing with the brain. We're now finding that there are GLP-1 receptors in the brain. So now there's all this talk about, could this help with dementia, just like hormones? But I think a lot of it is just the inflammation and the insults.
Yeah, it can absolutely help with dementia, but really, as we know now, Alzheimer's is being called type 3 diabetes. So just getting the insulin resistance down can help with the dementia for sure. Yeah, it's such a fascinating drug. And then the other thing that's really interesting, that you said about hormones is adding that layer. And I think one of the reasons we're so successful with it is we've optimized our patients' hormones. We're looking at their gut. We're looking at, a simple thing is that so many clinicians miss is, are you pooping every day? We don't talk about that, unless you're a GI doctor. And so it's such a key aspect of the whole assessment. And I love your take on the GLP-1s, because I think you're right. There's a lot we still don't know about them, but done right, we're going to see some amazing things. We just have to keep the ability for people to have an affordable option, because what's happening now politically is the pharmaceutical industries, and Eli Lilly specifically, is really trying to stop compounders from making tirzepatide, because the billions that they already make off of Mounjaro isn't enough. They don't want anybody else to play in the sandbox. And unfortunately, if that goes through, which is really, it's a political issue right now, it's going to take hundreds of thousands, if not more, of people out of the affordability range to be able to get these medications, because right now they can get them for, $300, $400, $500 compounded, and it's going to be $2,000, if Eli Lilly has their way. So we have to just bring awareness about what's going on in the compounding world, because it's so important. I want to shift go ahead. You have something to say about that?
With the gut, we do a lot of gut studies. I have seen amazing things with the gut too. It's ones like on gut studies. So like less leaky gut, a lot of the bad bacteria die, the yeast, things like that. So it is really fascinating, what happens with these GLP-1s. I mean, there's so many things. So just with the inflammation. So it's really powerful. And to your point, yes, people need to be very upset with the fact that Eli Lilly thinks they need to make $100 billion a year off.
Yeah, exactly.
Not allowed to, because the doses Eli Lilly has,
too high. They're too high. Yeah, they're too high unless you're diabetic, and even then, they're high to start out with, for sure. You said something really important there, and I love I want to talk about the gut hormone connection, because that's something you're really passionate about. I'm really passionate about it as well. But interestingly, you said GLP-1s have been shown to kill off the bad bacteria. Well, that's a key way that they would address inflammation, because the lipopolysaccharides that are released from the bad bacteria in our gut are probably the number one thing that is inflammatory in our body, in every system. So that kind of makes sense to me. But I do want to move on a little bit to this whole gut hormone connection. I want you to talk about the gut hormone connection. I know you've got an exciting book coming out this summer. I can't wait to read it. But let's just go there. I want to let you free skate with this concept of gut and hormones, and what do you know, and what are you finding, and what do you want people to know?
Yeah, I think, the reason I wrote this book, Dr. Terri, is because I feel like I had all these patients still as a functional endocrinologist whenever I was making their hormones perfect. And by hormones, I mean their estrogen, their testosterone, their progesterone, their thyroid. Everything looked good. They're eating well, they're sleeping well, they're exercising. But I still had this subset of people, and they're mostly women, who would come to me and say, I'm still kind of gaining weight. And we would look, and their insulin's rising. We don't really know why. And their CRP's rising. We don't really know why. Everything looks good. And so that's what really made me, okay, let's look at your mitochondria. Let's look at your gut. And what I found in all of those people who look perfect on paper was that they had terrible guts. And so then my question is why? And when you look at their labs, I can tell you if you have a bad gut based on your lab. Your CRP is going to be higher, your ESR, which are inflammatory markers, your insulin and or your cortisol are going to be high. If you're somebody who has hormone issues, a lot of your hormones are metabolized in your gut. And so when I really went back and I started looking at the gut, I found all these fascinating connections with, hey, when you lose progesterone, this happens in your gut. When you lose estrogen, this happens in your gut. When you lose testosterone, this happens in your gut. When you lose one of those, it affects how, so now you start getting leaky gut. So then now, let's say, like we were talking about, you're in your 40s and you start losing your progesterone. Well, that actually affects your gut a lot. And so then your gut, you can develop leaky gut, you can develop SIBO. Now you have all these lipopolysaccharides leaving your gut. That starts to increase your insulin level. Your cortisol was already high because of your progesterone. Now you're gaining weight. And so there is this huge feedback with your gut and your hormones. And it's like, even if you fix your hormones, you could still have stuff spewing from your gut. And so what I found was you've got to go fix people's guts, because if you don't, even when you fix their hormones, a lot of times their hormones, even though they're perfect, they're not going to feel well, or this inflammation from their gut is going to start affecting, their hormones. And so that's where I was like, okay. And when you start looking at people's guts, it's fascinating what you find, and it all makes sense, and it all kind of plays with each other as well, right? So it makes sense that if you're not digesting your food correctly because you have H. pylori or some sort of infection, or the gastric acid in your stomach is really high because you've been on a PPI for 10 years, even though they were meant to be given to people with their free months, then when we're not digesting our food, we're actually, instead of feeding ourselves when we eat, we're feeding our bad bacteria. And when we're feeding our bad bacteria, not ourselves, then we become micronutrient deficient. And then when we're micronutrient deficient, our body is not going to use energy to make hormones. But yet our bad bacteria are growing. So our tummy starts getting bigger, and we get bloated, and we don't feel good. And so it just all makes sense.
Sure does.
I feel like has put it together, though. Like when I started learning this and I tried to go find somewhere where I could be like, yeah, let me validate what I'm seeing, right? I want to validate what I'm learning and make sure I'm not crazy out there. It's not really there for anyone I couldn't find where anyone was teaching it, where I could validate these things for patients or providers. So I was like, okay, I got to put this in a book so that people understand this, so that people can actually get some help. And my point of the book was not only to help clinicians, but really to help people. Like I try to make it where a fifth grader would understand it. And I try to give them some very easy pointers as to, like, if you're having these issues, here are some basic things you can do. And I also created an app that goes with the book that's really awesome. It's almost done. But, I think you and I forget that we know things that we feel are very basic, like what is a processed food? What is fiber? Why do you need fiber? How do I increase fiber in my diet? Just things like that. And so I have an app that walks people through this, and you get a new piece of knowledge every day that takes less than 90 seconds. It's like me teaching you something. So exciting. Yeah, you get that every day, and it builds on each other for 4 months. And then, so you get that Monday through Friday. And then on Saturday is like a reflection time. And then on Sunday is like how are we going to incorporate this next week into our life thing? And it will just like walk you through this app for 4 weeks to help people understand how to make their gut health better. Because there's a lot of just crazy information out there that isn't true. So that's where I put it.
Are you looking for a healthcare provider who understands the importance of integrative medicine? Evexias Health Solutions is changing the way we approach wellness. We train practitioners on cutting-edge therapies focusing on a preventative care model. If you're ready to take a proactive approach to your health, Evexias can help you find a provider who's right for you. Just head to Evexias.com. That's EVEXIAS.com and click on the button Find a Provider to find a provider near you.
An endocrinologist that's passionate about the gut. My mind is blown. It doesn't exist. You are a unicorn, and I flip and love it. PPI, I'm always catching acronyms because we use a lot of acronyms. So for the listeners that don't know what a PPI is, that's a proton pump inhibitor like Nexium, all those Prilosec, we can name a couple of the other ones.
Prilosec, Nexium, Protonics.
Yeah.
If you feel a lot of clumps, if you have a lot of heartburn, you guys, that's not normal. You shouldn't have a lot of heartburn. So,
yeah, that gut hormone, gut endocrine connection is really important. The other thing that we get a lot of questions on and people get really interested in is talking about, we don't need to go deep in this, but do you see a connection? I've seen some literature that is pointing to this, to other endocrine abnormalities like PCOS, endometriosis in the gut. Can you talk just a little bit about that?
For sure. So actually my book has a chapter just about PCOS. It has a chapter just about how your gut changes with menopause, has a chapter about all of this. But yes, so much. So with PCOS, there are different types of PCOS. There are 6 different types of PCOS actually, and that's in the book too. And so it depends on what type of PCOS you have. But yes, that definitely influences your gut because it depends on if you're like a typical PCOSer with really high insulin levels, then we talk in the book about what does high insulin do to your gut. Well, what it's going to do is make you crave more sugary foods, have really bad cravings. And then if you give into those, you end up with yeast in your gut, things like that. if you're a PCOSer who has PCOS because you were put on birth control, so you can actually develop what's called post-pill PCOS. That affects your gut well in different ways. Yeah. If you have hypothyroidism, that can lead to some PCOS. So then I have a whole section in the book about how your thyroid hormone just affects your gut. Adrenal, there's an adrenal PCOS type picture. And so, yes, I go through in the book like how each of these things, your adrenal gland, your cortisol, your insulin, your melatonin, your growth hormone, how all those affect your gut. And I try to tie it back to your lifestyle as well. And so I teach people in the book, your sleep actually affects all of your hormones and your gut. And we talk about why, like what happens during sleep that helps you actually like make hormones, clean out your brain, clean out your gut, things like that. So yes, I do see a huge connection between PCOS and your gut. I actually have some gut types in the book as well. There's like 5 gut types that I typically see. And so I break those down for people like, if this is the symptoms you're having, and this is kind of the personality type that you have, or these are the things you have like PCOS or Hashimoto's or PCOS. This is typically what your gut looks like. And so I kind of teach people that too, so that if they don't maybe have the means to find a provider like myself or you, or get a GI map, they can go to the app then and say, okay, well, these are the things she said was wrong, or could be wrong with my gut. Let me go learn about how I can increase my fiber so that I can feed my good bacteria. Or let me go figure out how they can get rid of yeast in my gut so I can, so things like that. So I tried to make it where you can learn, sleeping more actually helps lower my insulin and my cortisol, which will help decrease the food available for my bad bacteria and lower my risk of having SIBO and stress-related leaky gut and yeast overgrowth, things like that.
Yeah, that you're blowing my mind still. I need to, number one, I can't wait to read your book because there's so much you have said just now that, I thought I knew a lot about PCOS, but I didn't know there was all these different types. But it makes so much sense because you see a patient that is presenting like PCOS, but they don't have the classic markers and they don't have, and maybe they're 45, and they're not really PCOS, they're headed towards menopause, and even postmenopausal women that look PCOS. So that's really interesting. I'm excited to learn more about that, for sure. So I'm going to throw back at you. I'm going to totally steal this from you because I loved your 3 questions, but I can only remember 2 of them, I think. But you asked really key questions of me when you interviewed me for your podcast, and I love this one question. If there is one, and you don't even have to say one word, if there's one piece of advice, I'm gonna change it up a little bit from what you did, so I don't exactly copy you. But if there's one piece of advice that you could give listeners just today, there's one thing that they can do that can really change their life. What is it, and what are some tips that they can do to accomplish that?
One of the things that I learned in 2022, and it was a really hard lesson that I hold very valuable to my soul, is that no matter what, you should always listen to your gut. Because there is this intricate gut-brain connection. It's real. And so for me, I think it is, listen to your gut. So if you're listening to this and you don't feel good, or you think something's wrong with you, or even though your labs are normal, listen to your gut. And keep listening to your gut and advocate for yourself until you find someone to be on your team. Because there is this amazing connection between your brain and your gut. And when something's wrong, your gut tells you. Yeah. And so I think so many people, there's so much noise in the world. If you really stop and breathe and think about things, a lot of times you can make decisions very easily by just listening to your gut. And so for me, and health as well, right? When you don't feel good. Everyone that's listening to this, all the women, all the moms, all the people who are working, I know, yesterday I was so tired. I walked into clinic, I was exhausted, and I just knew, I need to take a break. I'm tired. I need to take a nap. But we just push and we push and we push, listen to yourself. So I think that's the number one thing with your health. So this morning when my alarm went off at 5:30 this morning and I was supposed to go work out with my trainer, I was like, you know what? My gut still says I'm tired. I texted my trainer. I was like, I'm out today. I slept another hour and a half. I red lighted and cold plunged, and then I came up here to do this. Listen to your gut. That's going to get you so far in life and so far with your health, because your body will tell you if you listen to it. if you don't listen, it will scream eventually and you'll get diseases and you'll get sick. But if you really listen to your gut, then I feel like that is so powerful with your health.
I love that. And, one of the things that you said it's so true in our society is we feel guilty to rest. We know that we need to rest. We know we need to slow down. We know we need to put that phone down, and get away from technology. But this drive, it's almost like it's a badge of honor that, I work so hard and I'm so driven that I'm so tired. But you're exactly right. It will catch up to you in one form or another. Heart attack young, cancer. I mean, your body can only handle so much. And another thing you said that's really important, and we can kind of close with this concept, is your labs are normal. And you hear this all the time. I hear this all the time. You have, somebody that's come into your office. They've seen 2-3 other clinicians looking for answers for their depression, moody, irritability, their difficulty sleeping, their chronic fatigue, their chronic joint pain. Forget low libido, that you're not even thinking about all that because you're in so much misery over here. But they've gone to so many clinicians and said, oh, well, your labs are normal. And then a lot of people just accept that. But in this space of following your gut and following your intuition, just keep looking for someone that will listen to you, because it's not normal to feel those things. And I want to wrap up with your thoughts on that statement before we go.
Yeah. And even if your labs are normal, to the point we've been talking about is like, well, has your provider asked you then about your sleep? Have they asked you about, your gut or GI symptoms? Have they asked you about your stress? Have they asked you about your relationships? Sometimes we don't feel well. It may not be an actual issue from a hormonal perspective. It may be we have a trauma that we haven't processed. It may be we aren't feeling connected to our husband and our kids because we're running a million miles an hour. So we feel, we are very relational humans. Like humans are meant to be relational. And unfortunately, after COVID, I feel like people are just they're not we're not like in Europe. We don't sit down and eat dinner with people. We don't talk to our neighbors. So, you really have to just listen to your gut and figure out, is it my sleep? Is it that I'm stressed? Is it that my dad died 3 years ago and I never really processed it and I really miss him and I haven't said that out loud to someone? Is it, so just, I really think that a lot of our health issues could be addressed and we could get a lot further, a lot quicker if you have a provider that asks you about these things. To your point, I ask my patients all the time, do you poop every day? You have to poop because that's how you get rid of toxins. You have to sweat. And so it's just these little basic things that we miss, and then we can address your labs. And I never discount, normal labs for how you feel. But again, we just miss these very basic things about gut and about sleep. And if you're listening to this and you don't feel well, I tell people, have a check-in with yourself. So I have what's called check-in with Cassie. I do it every day. And I did it on the way to work yesterday. And that's how I knew today I needed to sleep in, is that I try to take a few minutes every day and I say, Cassie, how are you feeling? How are you really feeling? Do you feel are you well fed? Do you feel rested? Does anything hurt? Emotionally, how are you doing? How is your stress level? Just ask yourself these questions. It's a conversation you can have in your own head and you get more used to it. And now I'm to the point where when I have it, I know, yesterday, I knew I'm just tired. I just worked out a lot. I'm tired. It's been a long week. Your body will tell you, your gut will tell you what you need. This morning, I needed sleep. Tomorrow, I might need electrolytes, but you just have to listen to yourself and we have to normalize that. And we have to, your point, I didn't want to work out today. I was tired and I'm not going to beat myself up about that. You have to be okay with resting and you have to be okay with listening to your gut because that's your body. Again, there's just this really powerful connection between all your hormones in your body. And if you listen to that and let your body work how it's supposed to, it's going to guide you where you need to go.
Absolutely. And you have to be super intentional about it. And it's not silly to ask yourself those questions. I think to your point, we've just gotten away from, we've excused everything away. And there's this, you're talking about it, but it's this mind body spirit connection that we have. And we just kind of ignore everything, but we ignore all of it really. You're going to say something.
The last thing I would say about that too is I find this very powerful too. So I read this every morning, but you deserve the love that you give other people. Yeah. But like a lot of us don't think about that. Would you treat your child, husband, mother the same way you treat yourself? Would you talk to them the same way you talk to yourself?
Yep.
You deserve the love you give somebody else. And so and sometimes that's hard because we don't love ourselves and we've had issues we need to work through. But I think when you get there, like when you give yourself the love you give someone else, then that helps it talk.
So good. We just talked about that in our we have a monthly executive coaching call, and he was talking about before you can love others and love God, you got to love yourself first. And if you don't love yourself, none of the rest is just going through the motions. Thank you. So I could talk to you for hours, but I know we both have to go, but that just means we get to talk again. And I really appreciate your time, your expertise. And I mostly appreciate you for paying attention to your gut when you knew what you had learned and what you were doing wasn't right. And you took a leap of faith and you stepped outside the box and you took the criticism and you did it anyway. And you already are, you're going to be super successful, and so excited about the book. When that gets launched, people will be able to find it on Amazon. The title is up in the air, but that's okay. They can search for Dr. Cassie Smith, and all of your information will be in the show description. And I really appreciate you being here. Thank you so much.
Hey, everybody. Thanks for listening to this episode of the Dr. Terri Show. You know, it is truly my heart's desire to help people to bring awareness to key issues affecting our health, both mentally, spiritually, physically, financially. So if today's episode was helpful to you, would you please share this podcast with others? This information is vital for helping our country heal and restore our health, and we would be honored if you would pass it along to your friends and family. Be sure to subscribe so you don't miss any content from the show. And if your life has been improved by the show, please leave us a review below. We would love to hear from you. See you next time.